Vaginismus. Welcome to Body Hacks 101 with Dr. Nelson, where I show you how to optimize the natural powers of your body in order to boost your health. Today, we'll be looking at what vaginismus is, the cause, the symptoms, the treatment, and the prevalence of this condition. Vaginismus is a tightening or spasm of the vaginal muscles in anticipation of penetration, leading to either a painful or impossible penetration. This condition is a very distressing one to couples involved, as their sexual life is not consummated, often leading to frustration and eventual separation. Most of the times, it can be a cause of infertility in their lives. Usually, because of the sensitive nature of this condition and the stigma attached, most of the women often lead a life of isolation and are usually unwilling to commit to new relationships. The problem in vaginismus is not from the vaginal muscles. Rather, it is from the control of these vaginal muscles coming from the mind. Usually, fear and anxiety is the main trigger factors that causes these vaginal muscles to go into spasm or tightening. The fear and anxiety triggers sympathetic response, which is the flight and fight mode that comes in as a protective measure for the body. So the vagina attempts to withdraw, and by so squeezing itself and giving rise to the symptoms of pain and discomfort. These triggers can come from pain of past trauma like rape, childbirth, or even past infections like thrush. It can also come from perceptions like religious or cultural perceptions relating to penetrative sex. When these symptoms occur throughout a woman's sexual life, we say she has primary vaginismus. If she doesn't experience these symptoms before, and for one reason or the other, like past infections such as thrush or childbirth or any previous trauma to the pelvis, now begins to experience these symptoms, then we say she's having secondary vaginismus. Now, the symptoms. 1. Pain and burning sensation upon penetration. Remember, this penetration must not be sexual penetration. It could be other forms of penetration like gynecological exam. 2. Fear and anxiety upon attempted penetration. 3. Automatic or spontaneous tightening of the vaginal muscles. 4. Difficulty with vaginal penetration despite arousal and desire for sex. If, as a woman, you experience all these symptoms, it is time you saw your gynecologist, who will evaluate you further, grade you, and possibly refer you to a psychosexual expert and a pelvic floor physiotherapist. Now, the possible treatments that might be given to you include 1. A cognitive behavioral therapy. This is usually initiated by the psychosexual expert, and it involves managing fear and anxiety that is usually the primary culprit in this condition. They do this by identifying, understanding, and changing those factors that are responsible for this automatic contraction of your vagina. They help you change mindsets like cultural and religious perceptions about sex. They help you deal with past trauma like rape, helping you change your mindset about your sexual life. 2. Practice relaxation techniques and mindfulness techniques. These have been shown to to help you relax your body and mind by tapping into your parasympathetic system that helps to calm your body, especially those tightening or spastic muscles. 3. Retraining of the pelvic floor muscles by either Kegels exercise or pelvic floor exercise. The pelvic floor is a sheet of muscles that holds the bladder, vagina, and the bowels in place. Many times, this muscle can be under tension, and that could be responsible for the spasm or tightness of the vagina. Appropriate pelvic floor or Kegels exercise can help reduce this tension. A link to a typical Kegels exercise is shown in the comment section below. 4. We can specifically target these vaginal muscles through graduated vaginal dilation using vaginal dilators. 5. In some conditions, topical anesthetics, muscle relaxants, and estrogen creams may be used. 6. To ease penetration, pain, and discomfort, go for a water-based lubricant. 7. If an underlying infection is implicated, like in thrush, it should be adequately treated. Finally, and most importantly, is couple counseling. The couple has to understand that this condition is a highly treatable one and will require patience, perseverance, and cooperation from both in order to achieve the goal of the treatment. The prevalence of this condition in Nigeria and globally is not well known. Part of the reason is that most women often do not open up about this condition. Usually, they present when the condition is creating issues in their relationship or they are having an inability to have children. Then when the doctor does a gynecological assessment, he discovers that there is some grade of vaginismus. Based on a study on the prevalence and patterns of sexual dysfunctions among 212 patients attending a general hospital in Benin, it was shown that 3.9% had vaginismus. I'm sure this number would have been more if a more robust research was done. Finally, it is worth noting again that vaginismus is a highly treatable condition. All that is needed is for you to consult your gynecologist and possibly get referred to a pelvic floor physiotherapist and a psychosexual expert. Do not die in silence. Speak up.